Sam Stein.
Thank you, Mr. President. Following the elections, congressional Republicans are pushing once again for major reforms to your Health Care Act. In the past, you've said you're open to good ideas, but you don't want to undermine the bill. Can you tell us what specific ideas you're ruling out? Have the election results changed your calculus on reforming the law? And how confident are you heading into the second enrollment period? And on a totally unrelated matter, have you settled on a nominee to replace Attorney General Eric Holder? And if so, who is it?
You guys want to spread out your news a little bit, don't you? You don't want it all in just one big bang. On the Attorney General, we have a number of outstanding candidates who we're taking a look at now, and in due course I will have an announcement. And you'll be there, Sam, when that's announced. But I'm confident that we'll find somebody who is well qualified, will elicit the confidence of the American people, will uphold their constitutional obligations and rule of law, and will get confirmed by the Senate. On health care, there are certainly some lines I'm going to draw. Repeal of the law, I won't sign. Efforts that would take away health care from the 10 million people who now have it, and the millions more who are eligible to get it, we're not going to support. In some cases, there may be recommendations that Republicans have for changes that would undermine the structure of the law. And I'll be very honest with them about that and say, look, the law doesn't work if you pull out that piece or that piece. On the other hand, what I have said is there's no law that's ever been passed that is perfect. And given the contentious nature in which it was passed in the first place, there are places where, if I were just drafting a bill on our own, we would have made those changes back then. And certainly, as we've been implementing, there are some other areas where we think we can do even better. So, if in fact one of the items on Mitch McConnell's agenda and John Boehner's agenda is to make responsible changes to the Affordable Care Act to make it work better, I'm going to be very open and receptive to hearing those ideas. But what I will remind them is that despite all the contention, we now know that the law works. You've got millions of people who have health insurance who didn't have it before. You've got states that have expanded Medicaid to folks who did not have it before, including Republican governors who've concluded this is a good deal for their state. And despite some of the previous predictions, even as we've enrolled more people into the Affordable Care Act and given more people the security of health insurance, health care inflation has gone down every single year since the law passed, so that we now have the lowest increase in health care costs in 50 years, which is saving us about $180 billion in reduced overall costs to the federal government in the Medicare program. So we are, I think, really proud of the work that's been done, but there's no doubt that there are areas where we can improve it. So I'll look forward to seeing what list they've got of improvements.
Is the individual mandate one of those lines you can't cross?
Yeah, the individual mandate is a line I can't cross because the concept, borrowed from Massachusetts, from a law instituted by a former opponent of mine, Mitt Romney, understood that if you're providing health insurance to people through the private marketplace, then you've got to make sure that people can't game the system and just wait until they get sick before they go try to buy health insurance. You can't ensure that people with pre-existing conditions can get health insurance unless you also say, while you're healthy, before you need it, you've got to get health insurance. And obviously there are hardship exemptions. We understand that there's some folks who, even with the generous subsidies that have been provided, still can't afford it. But that's a central component of the law. In terms of enrollment, we'll do some additional announcements about that in the days to come. Starting in the middle of this month, people can sign up again. I think there are a number of people who, the first time around, sat on the sidelines in part because of our screw-ups on healthcare.gov. That's one area, Ed, by the way, it's very particular. We're really making sure that the website works super well before the next open enrollment period. We're double and triple checking it. And so I think a lot of people who maybe initially thought, we're not sure how this works, let's wait and see, they're going to have an opportunity now to sign up. And what's been terrific is to see how more private insurers have come into the marketplace so that there's greater competition in more markets all around the country. The premiums that have come in that are available to people and the choices that are available are better than a lot of people, I think, had predicted. So the law's working. That doesn't mean it can't be improved. Major Garrett.
Thank you, Mr. President. And if you do miss us, allow me to humbly suggest we do this every week.
We might. Who knows? I don't know. I'm having a great time.
Let me go back to immigration. Moments before you walked out here, sir, Mitch McConnell said, and I quote, that if you, in fact, use your executive authority to legalize a certain number of millions of undocumented workers, it would poison the well, direct quote, and it would be like waving a red flag in front of a bull. Do you not believe that is the considered opinion of the new Republican majority in the House and Senate? And do you also not believe what they have said in the aftermath of last night's results, that the verdict rendered by voters should stop you or should prevent you from taking this action because it was a subtext in many of the campaigns? Let me ask you a couple of specifics. Republicans haven't made a mystery about some of the things they intend to say.
Do I have to write all these down?
You're very well familiar with these. These will not be mysteries to you.
But
Keystone XL pipeline, they will send you legislation on that. They will ask you to repeal the medical device tax as a part of a funding mechanism of the Affordable Care Act. And they have said they would like to repatriate some maybe $2 trillion of offshore revenue at the corporate level by reforming the corporate tax code without touching the individual tax code. To use your words, Mr. President, are any of those three lines you cannot cross, and also deal with what you perceive to be Republican attitudes about immigration?
All right. I think, Major, that I answered the question on immigration. I have no doubt that there will be some Republicans who are angered or frustrated by any executive action that I may take. Those are folks, I just have to say, who are also deeply opposed to immigration reform in any form and blocked the House from being able to pass a bipartisan bill. I have said before that I actually believe that John Boehner is sincere about wanting to get immigration reform passed, which is why for a year I held off taking any action beyond what we'd already done for the so-called Dream Kids, and did everything I could to give him space and room to get something done. And what I also said at the time was, if in fact if this Congress could not get something done, then I would take further executive actions in order to make the system work better, understanding that any bill that they pass will supplant the executive actions that I take. So I just want to reemphasize this, Major. If, in fact, there is a great eagerness on the part of Republicans to tackle a broken immigration system, then they have every opportunity to do it. My executive actions not only do not prevent them from passing a law that supersedes those actions, but should be a spur for them to actually try to get something done. And I am prepared to engage them with every step of the way with their ideas. I think we should have further broad-based debate among the American people. As I've said before, I do think that the episode with the unaccompanied children changed a lot of attitudes. I think what may also change a lot of attitudes is when the public now realizes that that was a very temporary and isolated event, and that in fact we have fewer illegal immigrants coming in today than we did 5 years ago, 10 years ago, or 20 years ago, but that what we also have is a system that is not serving our economy well. So
Republicans who say the election was a referendum, at least in part, on your intentions to use executive authority for immigration.
As I said before, I don't want to try to read the tea leaves on election results. What I am going to try to do as president is to make sure that I'm advancing what I think is best for the country. And here's an opportunity where I can use my administrative authorities, executive authorities, and lawfully try to make improvements on the existing system, understanding that that's not going to fix the entire problem, and we're much better off if we go ahead and pass a comprehensive bill. And I hope that the Republicans really want to get it passed. If they do, they're going to have a lot of cooperation from me. So let me just tick off on Keystone. There's an independent process. It's moving forward, and I'm going to let that process play out. I've given some parameters in terms of how I think about it. Ultimately, is this going to be good for the American people? Is it going to be good for their pocketbook? Is it going to actually create jobs? Is it actually going to reduce gas prices that have been coming down? And is it going to be on net something that doesn't increase climate change that we're going to have to grapple with? There's a pending case before a Nebraska judge about some of the citing. The process is moving forward, and I'm just going to gather up the facts. I will note, while this debate about Canadian oil has been raging, keep in mind this is Canadian oil, this isn't U.S. oil. While that debate has been raging, we've seen some of the biggest increases in American oil production and American natural gas production in our history. We are closer to energy independence than we've ever been before, or at least as we've been in decades. We are importing less foreign oil than we produce for the first time in a very long time. We've got a 100-year supply of natural gas that, if we responsibly tap, puts us in the strongest position when it comes to energy of any industrialized country around the world. When I travel to Asia or I travel to Europe, their biggest envy is the incredible homegrown U.S. energy production that is producing jobs and attracting manufacturing, because locating here means you've got lower energy costs. So our energy sector is booming. And I'm happy to engage Republicans with additional ideas for how we can enhance that. I should note that our clean energy production is booming as well. And so Keystone I just consider as one small aspect of a broader trend that's really positive for the American people. And let's see. Okay, medical device tax. I've already answered the question. We are going to take a look at whatever ideas. Let me take a look comprehensively at the ideas that they present. Let's give them time to tell me. I'd rather hear it from them than from you. Major, well, conceivably, I could just cancel my meeting on Friday because I've heard everything from you. I think I'd rather let Mitch McConnell. I'd rather hear from Mitch McConnell and John Boehner what ideas they'd like to pursue, and we'll have a conversation with them on that. On repatriation, I said in my opening remarks that there is an opportunity for us to do a tax reform package that is good for business, good for jobs, and can potentially finance infrastructure development here in the United States. Now, the devil's in the details. So I think conceptually, it's something where we may have some overlap, and I'm very interested in pursuing ideas that can put folks to work right now in roads and bridges and waterways and ports, and a better air traffic control system. If we had one, by the way, we could reduce delays by about 30%. We could reduce fuel costs for airlines by about 30%, and hopefully that'd translate into cheaper airline tickets, which I know everybody would be interested in. So there's all kinds of work we can do on our infrastructure. This may be one mechanism that Republicans are comfortable in financing those kinds of efforts. So that'll be part of the discussion that I think we're prepared for on Friday and then in the weeks to come leading into the new Congress. Whew. Major, works me, man. Jim Acosta.